Thanks everybody for coming along today. It's so helpful to have a discussion and to talk all this through, because it's confusing and complicated for everybody involved, and we really want to work together to get this as right as possible. And it's really important that we hear from you and understand your perspective in this as well. We're going to be giving a bit of information to start with about how we see the key messages for the next few months ahead, what we see as the potential real opportunities, but also point out some of the risks with the months ahead as well, because we really want to support the One Stockport ambitions around a healthy, happy Stockport. And we know how much everybody's looking forward to these relaxations, as we've just heard in our chat. We want to do everything we can to sustain these relaxations and make those as long lasting as possible. And to do that, we really need everybody's help with getting the right measures in place to encourage safe behaviours as we start to reopen. Just as a reminder, we do now have in Stockport a new strain, as is predominant across the country, which is more transmissible than the strain we were dealing with back in summer, early autumn time. So I think we just wanted to flag that what was happening then, and perhaps if you didn't see cases in your setting, there is a real risk now with this more transmissible variant that we might see more transmission in the settings that haven't experienced that previously. And I know with some of our recent outbreaks, we've certainly seen that, people feeling a little taken by surprise that what they were doing before isn't quite cutting it this time round. And so just another note of caution that you just need to be mindful within all of this, that the timetable may change and restrictions may not be lifted on the dates that are currently proposed as the no earlier than. So it's just those points of caution as we move forward. Helen, do you want to just skip on to the next slide? I've popped this in there because it's kind of the most common question that we're all asking at the moment, isn't it? Are we there yet? Are we back at normal now, please? Can we, we've all had enough of this. Can we move on? And I think the message for now is not quite. We're well on the road in the sense that we have the vaccine now available, and the rollout is going phenomenally. So it's a huge point of optimism for us. But we're not quite there yet. We're just not at that point yet. And if we move on to the next slide, please, Helen. I just wanted to share with you the kind of latest trend in the Stockport data. Stockport's that blue line on the graph, and Greater Manchester average is the grey line. So you can see where we are in comparison to Greater Manchester. At the moment, we're just starting to see, a plateauing. We've stopped decreasing. What we're not sure of at the moment is, are our rates going to now start going up? Or is this a bit of a kind of bump in the road and we'll see a flattening that will then start to decline again? Or is this the start of the pretty inevitable increase in cases? So at some point in the next few months, cases are definitely going to rise. It's just a matter of when, really, and at what point that starts to kick in. So being mindful of that. I also just wanted us to take a moment to see here how quickly those cases can go up. And if we just look at the rise that we had at the back end of December and into early January, it was a matter of about 2 weeks that we went from a similar position to that we are in now to well over 400,000 per 100,000 in terms of the case rate. So it's to be aware of how quickly that can go up. If we just move on to the next one, please, Helen. I just wanted to highlight as well the age groups that we're seeing rises in. And throughout the epidemic nationally, and Stockport's no different, we've seen the case rate really driven by younger adult and working age adult populations predominantly in terms of their highest levels of rates in those age groups. we know that a big driver of transmission can and has been in that younger adult and working age adult population, whereas actually at the moment that population still is not widely feeling the benefit of the protection from vaccination. Obviously, vaccination programme is going phenomenally. We're over 45% of Stockport's adult population now vaccinated. We've done about 120,000 vaccinations across Stockport, and getting really good uptake in the most in the oldest age groups, and as we work through the other age groups as well, getting really good uptake there. So that's fantastic. The vaccine, we definitely know, protects well against you becoming severely unwell or the risk of dying from COVID. What's starting to emerge, but not 100% confirmed as yet, is that it does look like it also offers some benefit for breaking the chain of transmission and stopping you actually getting it in the first place. But that's certainly not as confirmed or as a greater proportion as the benefit you receive from the vaccination in terms of protection from the severity of that illness. So we've got this really risky period where the population who tend to be most involved in spread are still unvaccinated. We've got the vaccination programme going well, but if we see that as sort of two things coming together, there's a really risky bit in the middle where we have an unvaccinated population who are now welcoming the opportunities to start mixing again. And we could see things really take off and escalate. A few risks with that, if we do see those risks, if we do see those rates escalating again. Firstly, the vaccine isn't 100%, so that we still have people who either have been vaccinated or haven't been vaccinated who will still suffer the very negative consequences of COVID. And if we have enough spread in the community, it will get to those vulnerable people. Secondly, we know that COVID actually has negative long-term health consequences for a broad range of people, not necessarily death, but maybe thinking about the kind of illnesses like long COVID that we're starting to understand a bit more. So more spread means more people getting those types of impacts as well. And then finally, and probably the biggest risk actually at the moment, is around the development of new variants. So we've already seen new variants emerging across the world that alter the current COVID enough to either make it more easily spread, make it more severe in terms of the illness, or make it evade the vaccine, make it different enough to the immune system you'll have in your the immune response you'll have through vaccine, that it could put that at risk. And if we got one of those variants, and if we got it when COVID is already spreading fast, there's a risk there that we're kind of back into a real high epidemic with high negative outcomes. So those are the kind of key risks that I see as we open up if spread becomes really fast, sustained and unchecked. So a quick reminder about the things that we can all be doing as we welcome the opportunity to have more flexibility in what we're doing day to day. Let's keep doing those things in a really safe manner as possible. So just a quick recap on infection prevention control. This is the same principles for any infectious disease or illness. You need all of these things in the chain for the bug to spread. You need an infectious agent, the thing that's actually causing that infection. In this case, it's SARS-CoV-2. You need a reservoir of infection. And again, in this case, it's us, it's people having that infection. And you need an exit route. And for COVID, that's coming out as droplets and aerosols from your nose and mouth, which is why, if we were looking to break the chain, one of those things can be wearing a face covering. And as long as that's going right over your nose and over your mouth and covering you well there, that's essentially catching those droplets and aerosols that you're expelling. We need a method of transmission. So how do those droplets get from one person to the other, and that's either the direct spread, which is why taking a step back, keeping that 2 metre distance stops that spread from the direct droplet transmission. Opening the windows, keeping places well ventilated, stops that aerosol build-up in the environment, and cleaning. So those droplets could have landed on a surface, which then becomes contaminated. Cleaning that surface stops that transmission then from getting to other people. Thinking about the route of entry, we've got your hands, your eyes, your nose, your mouth as places. So your hands touching your eyes, your nose and your mouth can take, if you've touched a contaminated surface, or if you've had droplets directly onto you. If you then enable those droplets to get into your membranes through your eyes, your nose and your mouth, that's the route of entry into you. So hand washing, really, really important. Not touching your face, another preventative measure there. And then actually the face coverings again can be helpful in some respects in that way, more so with the exit route. And then finally, you need a susceptible host. And at the moment, we still have a good chunk of the population who are susceptible. The vaccine comes in at that point in the breaking the chain to reduce the number of susceptible hosts, or reduce the likelihood that you're a susceptible host, and breaks the chain there. But you can see how all of those different infection prevention control, all of those different steps and measures come in at different points to break the chain of transmission. And this is what we're trying to constantly do. If we move on to the next.
Yeah, there's a question in the chat about explaining why the new strain is more transmissible. Maybe, I don't know whether you want to do it at the end or on this slide. I'll
come on to it at the end if that's all right. I'll just make sure I've understood. I'll read the question in the chat and help to understand. Yeah, okay. Thanks for that. I'll just move on to the next slide and then we'll talk about that one. So I just wanted to reiterate that through all of the techniques and steps that I've talked about there, not one single thing is the be all and end all in this. I really like this model of a Swiss cheese pandemic defence, because with all of these steps and measures, there are some holes in each of them, but the more of them we do, the more consistently we apply them, and the more of them that are stacked up, the less likely we are to see that transmission. So it's really important that we consider all of those things when we come on to think about the steps ahead, so that we're not seeing it as, okay, so we're taking some of those slices of cheese away, we're taking out certain restrictions, let's keep in all of the others around distancing, masks, hand hygiene, isolation if you're unwell, isolating contacts. All of those other things need to remain as we move on.
Can you explain how the new strain is more transmissible?
Yeah, they're still looking into exactly how it is. It's spread in exactly the same way. So the theories are there's either more of each, more of the virus in every droplet potentially. So it's spreading in that way, or the virus has evolved to, when you get that transmission, be better at getting into you and infecting the person it transmits to. So there's those the two broad principles about why it's likely to be more infectious, but we are seeing higher attack rates in when we have an outbreak. We certainly are seeing more people who were exposed at the time of somebody being infectious then becoming secondary cases than we have been before.
That you talked about the plateauing, or we don't know whether there's going to be an increase in the cases in Stockport. Is that largely down, do you think, to the fact that there's more workplace testing and we're testing in schools?
Part of it, but the cases are there to find, aren't they? So absolutely. About a third of cases are asymptomatic, so being involved in that testing regime can be helpful at finding those asymptomatic cases. If anybody wants to know more about how we can support you with getting set up for testing in your workplace, we've put it on a later slide, but do email us at testing@stockport.gov.uk. I know there's a direct Bays offer as well, but we can support people in understanding what the options are and how to interpret tests and so on. So some of it will be that, which is why it's important for us to see the trend over time, and how that then translates into new infections, and how we monitor that over time. So it's something we keep a good eye on, but we know more mixing is happening as well. So just need to be mindful of what's being picked up versus what's really going on there.
So hello, I'm Mark Glynn. I'm Director of Place Management, and my colleagues here today are Adam Forbes and Ian O'Donnell. They are responsible for, amongst other things, we're responsible for the pandemic response team. So we've been out and about, engaging with businesses, engaging with the community the last 12 months, trying to promote, support businesses and promote the right behaviours amongst the community, and just reiterate the requirements around space, face and hands, etc. And obviously, over the next few weeks, it's going to be quite a busy time. I think I ought to start just acknowledging that the council is coming from a position that we're all really looking forward, as Jen said, to the easing of the lockdown, and we really understand and do empathise with the enormous difficulties that business owners have had the last 12 months and how dreadful it's been. And we want to do all that we can to make this easing of the lockdown as sustainable as possible, and to make Stockport's recovery as strong as possible. And I think, hopefully you'll hear from what you've heard from Jen and what you hear from me and my colleagues, you'll see that that's the place we're coming from. So although we come with some messages that are a bit limiting and reminding you of some of the things that we hope that you can do to support us and support the borough, it is coming from a place where we want to protect that easing and protect the low rates that we've got in the borough, and make sure that we don't go backwards. So stage 2, no doubt we're all looking forward to 12th of April, as you can see there. Here's some of the highlights for it, and we've highlighted essentially what we're focusing on today, the hospitality sector. So you're allowed to serve customers, groups up to 6, sitting outdoors from the 12th of April. But there are a number of other things happening as well, which are really important to us. Non-essential shops are opening, gyms and spas can open, and there was a bit of a chat at the start of this meeting about hairdressers and that kind of personal treatment. That's all opening on the 12th of April. Obviously, some of us have been okay. We've been exempt from those kind of concerns the last few months, and I've been able to manage quite happily without a hairdresser, but I know others are looking forward to it. So if you could flick on, please, Helen. So we've highlighted here, this is, and I'll ask Adam to come in a second, but this Adam was engaging in I think it was a government webinar the other day, and these were the 10 things that the government is stressing, and I think they overlapped with the messages that we want to get across and share with you today, around the things that we think that the businesses need to focus on in order to make the reopening safe. I won't read them all because you can see them, but I'm assuming you can all see them. But what I would say is that, just picking up on what Jen's talked about in terms of transmissibility of the current strain, there are greater risks than last time you open of things spreading. So it is doubly important that you take all these things seriously, and that you do all you can to make it as safe as possible. So we would recommend the COVID risk assessment, obviously cleaning. I think the things that we would like to remind you most of is about that kind of interface between that outdoor seating and when people have got to come in and go to the bathroom, and how that's managed, how you're managing people that want to get around the rules and maybe book 2 or 3 different tables, and how you manage the kind of off-license kind of strand of businesses where maybe people are buying drinks to take away and they're congregating a few meters away from the premises. We need to make sure that we're managing those things as best we can together. Adam, do you want to come in and talk a little bit about the webinar and provide a bit of flavour to this slide, please?
Yeah, sure. Thanks, Mark. You're probably familiar with many of these actions from the last time we were, all restaurants and hospitality premises were allowed to trade. But as Jen says, it's even more key now with this new strain. The cleaning more often. The focus there is clearly going to be on the places that have most use. So when we're opening premises outside, that will be the route to and from the toilets. One would expect there's lots of touch points there. Customers are required to wear face coverings inside in any indoor space. So that's something that will be part of the risk assessment. Make sure everyone's social distancing. Now, we can help here. Obviously, the route to and from the toilet might be a pinch point. So one-way circulation would obviously help with that so people don't have to cross. Increased ventilation, that's pretty easy to do outside, isn't it? But clearly in the toilets, that is also something that needs to be considered. Ventilation is a very helpful mitigation measure in the control of the virus. Support NHS test and trace. That's the little QR code that people sign into businesses to allow any outbreaks to be tracked. And turning people with coronavirus symptoms away. It may sound entirely logical, this, but you'd be surprised that not all businesses have complied. And this is particularly relevant with staff as well. Obviously, you wouldn't want your staff members working even if they have a sniffle these days. The rule of 6 will be introduced on the 12th of April. That will mean that 6 people from different households will be able to meet, and up to two families will be able to meet as well. So that's something that in the booking system, when customers call up to make these bookings, that customers can be made aware of. Contactless payments, I'm sure many of you have, and as Mark mentioned earlier, how does your business interact with the local area? Live events, we certainly don't expect them to be allowed from the 12th of April. However, the regulations have yet to be made. We expect those next week, so we'll be able to clarify that in a letter to all the businesses that we'll be sending out.
Can I just come in on the question? So we've had a question about how likely is the 12th of April date that it'll stay, and will it not be confirmed until the week before? I think I'd say a few things on this. That we don't know for certain. I think we all recognise that we'll be under. The expectation is from government that they, obviously we want to ease things by the 12th of April. We will have a better sense over the next few weeks as we all follow the rates and see what's happening. And there'll no doubt be a national debate, but we're not expecting confirmation until the week before. So there remains uncertainty. And as Adam was saying, that I think there's a bit of uncertainty. There might yet be some additional guidance I think we're expecting that will come out that we will share with everybody once, as and when we've got it. But we don't have that at the moment. So I think it's fair to say that this remains a slightly fluid situation, and it's a provisional date for the time being. We'll have greater confidence that it's going to be solid the nearer we get to it. Anything you want to add to that, Adam?
No, Mark. I was just moving on really to the talking about the risk assessments. It's very important that those are sort of shared with your staff that you manage, obviously to help manage those risks and to ensure the mitigations are in place. Outdoor structures, that's a very common query that we're having at the moment. What constitutes an outdoor structure? And for those of you in the hospitality trade, you're obviously very familiar with the smoking regulations, and we're using that as a guide as to what is an outdoor structure. So I think it needs to have no roof or to be open on 3 sides. So a tent or a marquee with sides and a roof would not be considered an outdoor structure for a reopening on the 12th of April. Spoke about toilets. Customers will I'm pleased to say, be allowed to use toilets inside premises. Obviously, as I mentioned earlier, the one-way route into and out of the toilets, the ventilation in the toilets, the cleaning of touch place points on the way into the toilets, and customers wearing face coverings are key considerations with that. I spoke about the Rule 6 really as well. When taking bookings, this is something you can explain to callers. Six people from 6 different households will be allowed, and 2 households will also be allowed. We're waiting confirmation as to whether the definition of a household includes a support bubble, but I very much recognise this is a very difficult thing for hospitality to police, but it's a duty of care to sort of question and make customers aware of these limitations. The council are very keen to help businesses extend seating areas where possible. So that could be out onto the pavement if the width is wide enough, or perhaps into a car park or a neighbouring area. So we're very keen to work with businesses if you wish to apply to extend your outdoor space during this period. If there's an outbreak, it's very important that this is reported to the Stockport Council. And the track and trace team there will follow that up, and colleagues in public health will assist managing that outbreak. As Jen noted before, there's the email of testing. Should you need support, testing of your employees, that the council is available to do that. And finally,
just jump in there to say, on that web page that I've put the link to around what to do if there's an outbreak, there's more information on there as well, but there's also a button where you can report directly into us and put the details in of the situation that you're finding, the outbreak that you might have. We've also got phone number and an email, which I'll put into the chat now, where you can contact us. If you've even just got one case and you want to make sure you're doing your contact tracing correctly, or want some advice about that, then please do get in touch. We'd rather know about things than not, really.
Thanks, Jen. And really, the final point on this slide is takeaways. Hospitality premises and bars will be allowed to start offering takeaways from the 12th of April, as they were previously. It's key here how this is managed safely. We wouldn't expect a bar to be serving takeaways and people congregating, standing outside on the street drinking those takeaways. So that's something to consider on how to manage that safely and the reopening safely. There's a guide on how to complete a COVID-19 risk assessment. It's obviously different for every business, but that obviously has the key points in. I'll happily share that with you after this meeting.
Yeah.
We intend to write to all hospitality premises, and that information will be included in that letter as well to all hospitality premises across the borough. And that should be hitting doormats or inboxes in the next week. Yes, it's indeed a requirement to display that QR code. Whether that's on the table or whether it's as you enter the place. But then it obviously helps track who is sitting where and who is in the venue should there be an outbreak in the future. I mean, on the 12th of April, in addition to reopening of bars, all non-essential retail is allowed to be open as well. So, yeah, the mitigations will need to be in place and ensure no overcrowding. But yeah, your bottle stock will be able to open.
I think Adam's made the point. Yes, of course. What we'd hope not to see or expect not to see is that wasn't being that, and I'm sure it's not the case in your premises. But we wouldn't want to see premises using that kind of facility or that easing of the lockdown, and there being gatherings, a few meters away from a bar, and it being used as a way of kind of creating an alternative outdoor drinking market. Can businesses refuse the use of their toilets, perhaps notifying customers in advance, i.e. emergencies only?
Can I come in on that one? That would help.
Yeah, please, Ian.
Businesses, pubs, hospitality businesses are not required by law to provide toilets for customers. They should provide facilities for staff. So I suppose that would be a call for the business, really. They could refuse to do it. the obvious concern will be that if you have a busy pub with no toilets, then what does that say about the local area? So I think my answer would be technically yes, but from a from a neighbours, from a resident's point of view, it's just going to cause problems, I think, to try and open in that way. And one thing we need to be mindful of is that a lot of pubs that are going to be opening now will have been quiet for a few months, and a lot of residents will have got used to that. So yeah, we'd always encourage pubs to operate, but operate in a good neighbourly fashion, and not opening toilets to me doesn't feel like it's really doing that.
Does that depend, Ian? And Michelle, you might want to come in here. It's your question. Does that depend on if it's a cafe? There'll be some cafes that are not selling alcohol that don't offer toilets to their customers, presumably.
Yes, that's right. It's not a legal obligation to provide customers toilets.
So a cafe might do that. I think correct me if I'm wrong, Ian, we'd have more concern if a premises were selling alcohol.
I think so, yeah. I think if it's a pub and people are going to be in there for a while, then yeah, that people are going to want to go to the toilet. And if the toilets are shut, then yeah, that will be a concern from a wider public health point of view and a neighbourly point of view from the pub.
Yeah, Michelle, did you want to come in on that?
No, I think the toilets are the main area of concern whenever I've done risk assessments, whether they're tucked away and it's, managing the toilets, people going in and out is usually in a narrow environment. And of course, the cleaning as well, before and after, as people going in. But I think policing that is a real nightmare. There are people out there that still don't wash their hands when they've been to the toilet. And I think that's the real, keeping people apart is easier everywhere else but the toilets. I think that needs an awful lot of attention, and it's obviously business unique to their structure.
I'm really glad you're saying that. I think it does need, and I accept it, as Adam said, you can lead a horse to water, but we'd hope that businesses have come up with plans of how to encourage their customers to use the facilities properly and don't just leave it as a free for all. But we accept that there will be people that choose to ignore the rules.
Yes, certainly. Well, stage 3, as you can see there, no earlier than the 17th of May, which we're then obviously allowed to go inside the hospitality venues, and customers will be allowed to be seated indoors. The details are sketchy about what is required here, and the details are not confirmed about whether this will be the case. So as council, we intend to write to all restaurants and hospitality venues in advance of this stage 3 reopening to confirm what the requirements are in terms of toilet social distancing, mask wearing, etc. Once they all become clear. There's a whole raft of other relaxations happening around the same time, as you can see there, with indoor entertainment, outdoor entertainment, and indoor sports and exercise classes, which will be welcome for many.
And I think what I'd like to say is that we will be contacting premises, but we are here, and if people want to talk through, how they plan on organising toilet queuing, for instance, we're glad to help, and and Adam's team have been out and spoken to an awful lot of premises in previous incarnations of the last 12 months, and we have a lot of. There's some premises that have got some really tremendously good practice and some ideas that we would gladly share and kind of point you to, depending on your specific circumstances. And we want to have that positive, constructive dialogue, and we will be sensitive in our way through this. However, we will also, Adam's team will be going out and undertaking compliance visits, just how well is it going, how well are we doing, and obviously if we've got concerns, we'll come to you and talk to you, and as long as you're trying, you're doing your best and you're engaging with us, then that's all we can ask for. But we we have taken action in the past against those premises, and I'm sure none of them will be on this call, because why, if they don't care, they're not likely to be listening to this conversation. But there have been some premises that really were quite reckless at the start, and we'll take action if premises are reckless and just willfully ignoring concerns about this. So just to reassure you that we won't let it be a kind of Wild West, and other premises that are not following the rules will not, we'll intervene. But we want to be supportive and constructive in our conversations with premises, because we know that everybody's finding the way through this, and it's not easy. We absolutely respect that.
Mark, can I just ask? A lot of, obviously, that we've talked about so far, that Jen's talked about, and you and the team have talked about, those principles apply for all businesses, not just hospitality, in terms of making sure you look after your cleanliness, be aware that it's more transmissible, etc., etc. But I seem to recall that when non-essential shops and businesses were encouraged to go back last time, all businesses had to carry out a risk assessment. Is that not going to be the case this time?
Risk assessments are required by businesses as part of health and safety law.
Yeah, for when they reopen, Adam, when the government starts to encourage people to actually go back into the offices, will those businesses be required to carry out their own risk assessment?
Yes.
Okay.
Yeah, they're not required to be submitted anywhere, but a business is required to have a risk assessment prior to reopening. Yeah.
Okay.
And I think if we had, we'd be happy if a business wanted to share it with us and ask us any questions. We'd be more than happy to engage in that conversation. And obviously, if we went to a premises that we had really serious concerns about, we'd want to see what their risk assessment was, as and when there are problems that arise. But just reiterate the point again. We encourage, and we're wanting to support businesses, and what we've set out here, and we will set out in our correspondence, are the areas that we think businesses need to consider when reviewing their risk assessment, and not to forget that this all comes from a position, as Jen said, that this strain is more transmissible. So because you had a risk assessment last year and you were okay, no serious issues, you still should look at it again and review it again in the light of the increased transmissibility. And make sure you're doing all the things that you can do, all reasonable things. So there's another question here, Adam, from Gary, about indoor entertainment, and specifically, would karaoke be okay? So we had the argument last time that entertainment was allowed, as some pubs were allowed, but as a company we were told that it wasn't.
We don't know yet is the honest answer. The regulations have not been published for that. We're hoping that they will be published next week before Parliament goes into recess for Easter. But at this stage, we don't know what the definition of indoor entertainment will be, I'm afraid.
I think what I would say, though, Gary, is if you asked me for my opinion, I think it's unlikely that karaoke will be supported, because if Jen talked through, and Jen will be able to elaborate on this. You think about the way that this disease is transmitted. It's those droplets, and what we were being encouraged to last year was to, and licensees are encouraged to do, is to discourage people shouting and singing and getting animated, because that brings up more spray, more and increases the transmissibility. So I would suggest that there's some doubt about that, but we can't be absolutely clear at this point. Jen, do you want to come in?
I think you've covered it really, Mark. There's some principles around how what makes things more risky, and if you think about indoors is more risky than outdoors. These are broad principles. Volume is one of those things that makes things more risky. So if things are being done at a louder volume, because you're having to project your voice, as you described, Mark, that can make things more risky. Duration, so the longer people are spending in the same place with the same people, and numbers involved, those sort of factors. We've talked about it in terms of the principles of the 3 C's: crowded, closed environments and close contact. But those are the kind of principles of things that make things more risky. So with volume being one of them, there's specific guidance around singing that's previously been produced, and from my distant memories of karaoke bars, I don't think you could really apply them to karaoke in most premises, unfortunately, but we'll see if there's further guidance issued.
Ian, do you want to come back in?
Yes, it was just to make another point, if that's okay, particularly for hospitality businesses and thinking about the licensing side of things. Advice would be to check the license that you've got, check your premises license and see what it allows you to do, because one of the things we're waiting for at the moment is to see what changes there could be nationally around licensing. If you remember last summer, there was an arrangement put in place that meant that every pub or every premises that had on sales could automatically sell off sales. That was put in place, but it was only put in place until the end of September. So I think I'd say there's probably an expectation, given the mood music around this, that this will happen again, but we've not seen it at the moment. And we're already starting to have queries from licensed premises who say we're looking to serve outside, but our existing premises license only allows us to serve outside until 9:30, 10 o'clock. If that is a condition on your premises license, unfortunately, it will still be there unless anything happens nationally to remove it. There is a process locally to amend premises licenses if necessary. But again, I'd just say, check your premises license and contact the licensing team, or contact us at the council, and we'll see what we can do to help guide people through the processes that are necessary.
Hang on. It was just a point about the risk assessments, because you mentioned sort of officers as well. I think for a lot of businesses, they haven't done a risk assessment before. And I think, obviously, I've been doing a lot of them over the last year and updating them as things change. I think the easiest way to get across to people is to treat this as it is a hazardous substance. So for a lot of businesses, they haven't had to even think about hazardous substances before. It actually comes under COSH. And it does help in the business's thought process to look at it from that point of view and apply, the rules in that respect as well. If that makes sense.
Yeah, thank you. I think it does. Yeah, absolutely. Absolutely. Can I just pick up on the licensing thing? So just if I want to add a further point to what Ian just said, that we probably should have been explicit in here that the government's been explicit that the curfew won't apply. So there was a 10 o'clock curfew at one stage last year. That's out. That's not looking likely at all unless anything changes. And a reminder again around licensing, as Ian says, come to us if you've got questions and issues. We will be as supportive as we can be, because we know how hard life has been. We want to absolutely promote, and we will be promoting within Stockport, part of our One Stockport message. We'll be saying to Stockport residents over the coming weeks, go local, use your local shops, use your local bars and restaurants, and support those bars and restaurants by following the rules and by wearing your masks and keeping the space, and that the best businesses will have safe plans in place. And we want you to, support those plans by following the correct behaviours. We won't put it quite so clumsily as I just have done, but that message will be going out over the coming weeks, as well as us contacting businesses and just keeping you up to date as and when we know a little bit more.